back to the Lipoedema podcast. We are your host, Shell.
And Tiana. And tonight we are unfortunately not in the same room, but it is just us two again because we are going to recap day 2 of the Lipoedema Australia Conference 2024. Yay!
So first up, I can't really reflect on the first speaker we saw because it was me.
Oh
so
my gosh.
I did my presentation.
And of course, we couldn't divide and conquer at this point because I was desperate to see Shell's presentation and also just like be there for her because this is the first time, Shell, you have done anything like this before. And can I just say that you nailed it? It was so good. Shell had people crying in the room with her moving stories, and then she brought them all back with some actionable tips. I thought it was absolutely fabulous.
Oh, thank you, babes. Like, yeah, you are my hype girl. Like, yeah, you're my anchor. So, yeah, I needed you there. That was amazing. And yeah, the few times, so I had to stand behind a podium, which was good because it grounded me as well. But I had to stand there because everything was being videoed. So I was able to look at my notes and then look up. And at one point in my presentation, I played a clip. And this clip is very moving, and it was sort of to then so I could springboard off of that into the actionable things we could do. And I looked up, and people were crying, and I was like, "What have I done?"
Oh, you made everyone cry.
Made everyone cry. But
Look,
then I saw a lady. Oh, sorry, Daz. I saw a lady afterwards, and she said that I made her cry. And I said, "But do you feel better?" She said, "Yes, I think I needed to cry, that it was very healing." And I'm like, "Oh, okay, good.
Oh, that's really good feedback. And we're not going to give too much away of your talk because, of course, in episode 49, our listeners actually get the pleasure of hearing your entire talk, which is so exciting. So whilst Shell was doing her presentation, which was Body Acceptance, a Rebellious Act, in the next room there was a fashion parade happening. And so we could sort of hear a little bit of like cheering and music and stuff, but actually I was so engaged with your presentation I didn't really hear any of that.
Yeah, I think it was actually pretty good. Like those big double doors they brought out were very good sound deadeners because I thought, because I wanted to be in the fashion parade as well, so I was like so torn. So I'm glad the people that came decided to see me instead of the fashion parade because that was lovely.
Yeah, you did have lots of people in the room and that was really nice. So then after you got through that, we did divide and conquer. And so I went to see a panel discussion regarding surgery, and it was a live Q&A type thing. It had 4 ladies that have had lipedema surgery before, and 2 of them are also part of service providers within the community. One of which is Dr Ramin Shayan's senior nurse now. So two very experienced service providers, I guess, but they've also been through lipedema surgery. And then a couple of our board members who were also lipedema warriors and have had multiple surgeries. So that was super interesting. And as I said, it was a live Q&A format. And the way that Lipedema Australia did the Q&As, which was interesting, was you submitted your questions on an app, and then they had a facilitator of the Q&A discussions, which in this particular one was our Lipedema Australia chair, Jen, and she asked the questions from the app. So that, I can't imagine how stressful it would be to try and field through all of the questions and ask it on stage, but she did an incredible job.
And the other thing to that, which I only figured out the second day, was while you're sitting there listening, you can look at what the questions are and you can vote for them. So if there's a question on there that you like the sound of or something you'd really like to know, you could vote for it. And that pushed it up the line. So as poor Jen's sitting there reading them, the feed could keep changing depending on who was voting for it.
It makes it pretty hard, but what a great idea. And so I have a few takeaways, and then I'll go to you, Shell, about what you learnt in your session.
Yeah.
So one of our uh, lipedema warriors that had numerous surgeries said she didn't feel very well, and this was after her first surgery, but she didn't say anything. And it turns out she needed a blood transfusion. And in her
Oh,
mind, she thought, well, maybe like my pain tolerance is really bad. Maybe I'm just being a wuss. Maybe I'm just emotional. And it's sort of like the key takeaway there is if you're feeling sick, speak up, because the nurses and the doctors can't do anything for you unless they know what you're feeling. So just be really diligent with that. Also, it's really common for your blood pressure to drop when you're going from sitting or lying down to standing after surgery, not only because of the anesthetic, but because volume has been taken out of your legs. And sometimes, especially if you're going to the bathroom, your compression is moved or off certain spots that still need compressing. And so when you stand up, that the blood pressure drop might cause you to faint. So you really have to be diligent with how you're feeling with that as well. We don't want a safety issue. We don't want you falling on the floor and hitting your head or anything like that. So a couple of things to keep in mind directly post-op. Another interesting one, and this was from Sally, who is now Ramin Shayan's head nurse, and excuse me, I don't know the right title for her, but she's incredible. She's had a few surgeries, and she actually said that she has mast cell activation syndrome, which is a topic that was brought up numerous times over the Lipedema Australia conference this year. And so she had some wound complications. And if you have seen Dr. Shayan's work, he actually the wound goes from sort of ankle to groin all the way up the leg, and the wound can look quite full on. And then when you think about having wound complications, you're like, oh my gosh, how is this going to heal? And in fact, so surprisingly, she told us that the wound healed beautifully. And I just find that amazing. Like, even with complications, the way that that massive wound can heal is quite incredible.
our bodies are amazing. So Sally Baker is a lymphedema and lipedema support nurse.
Amazing. Thanks, Shell. That's
Yeah,
great.
no worries.
They also, and this is Ramin's patient as well. So there were patients from different surgeons, but Meegan, who went with Ramin, and because he does one leg at a time, spoke about how having one smaller leg and one bigger leg wasn't that much of an issue for her, particularly because there was the corresponding swelling with the smaller leg, as well as having to wrap it really tight with lots of compression. So initially she didn't really see that much of a difference. And then she said, interestingly, when she started to get more into her recovery and show off her leg a little bit more and have one big leg and one small leg, say she was wearing leggings, nobody noticed unless she pointed it out. So it just goes to show that, like, that message of nobody cares and nobody's
Yeah,
looking at you.
no.
Because I know when I was thinking about that one leg at a time situation, sometimes it's 3, 4, or 5 months in between, depending on how you recover. I would feel self-conscious that I have one small and one large leg. But in fact, for Meegan particularly, it didn't quite bother her, which I found interesting. I'm going to leave you with two last points. And this one I thought might be particularly interesting for our audience. So different surgeons use different Medicare/surgical codes for what they do, depending on their experience and depending on your diagnosis. And those codes are what influences how much is reimbursed by Medicare and or private health. So to give you one example, if you have a corresponding lymphedema diagnosis, there is actually a medical code for your surgery to remove the lymphedema. And because lymphedema has a Medicare number, you can actually claim more of your surgery back. And that's just one example. So I think it's really important for you, and it's not shopping around in terms of getting the best value from your surgeon, but it's just being smart about getting a holistic picture of your full diagnosis, not just lipedema. So then you can maximize any benefit from Medicare or from private health based on the surgeries that you need. And the last point I'm going to leave you
Yeah,
with
that's a
is
great point, isn't it? Because
mm,
we don't think of that.
no. And look, I was conscious about it at first when I had my surgeries because I did have that corresponding lymphedema diagnosis, but I don't think we've actually brought it up very often, and I thought it was a really good point. And the last thing I wanted to leave you with from that particular Q&A session was a reminder that when you go under anesthesia, it actually has a massive impact of your physicality, especially in the first week. But that impact going under any kind of anesthetic can last for weeks and months. So the recovery is long, and you just need to be gentle with yourself.
Yeah, good point. Good point. And I think, and that comes back to, and I love how you took that away, that we've got to listen to our bodies. Like, so a lot of us have just been, I'll use the term gaslit because, everyone's sort of using that at the moment, and it is very relative, that you go to a doctor and you say something's wrong. They're like, oh, nah, just exercise, you need to lose some weight, eat less, all of those. So we start to disassociate from our bodies and we don't listen to these warning signs they're telling us. So yeah, post surgery we need to really be in tune with our bodies.
Yeah. Agreed.
Yeah. All right.
So
So
where did you go?
I stayed in the same room and I saw Marti Klein. So she's it was about lipedema self-management from her perspective, and she is a health and well-being coach. So she actually said that when she started, she was a health and wellness coach, but people looked at that as like the whole body. So she changed it to well-being because she really wanted to focus on mental health more and like the things we can do in our life, because nearly everything affects our mental health. And so she really wanted to go into that. So she spoke really practically just about eating nutritiously, eat mindfully, enjoy eating, like really get to enjoy your eating. Make sure you sleep 7 to 9 minutes. And she actually spoke about, and
Sorry,
she
was
spoke,
that 7 to 9 hours?
oh, hours, minutes. 7 to 9
Very good.
hours. Oh, you can tell I'm still recovering after an amazing weekend. And
We
she
only
played
slept 7 to 9 minutes, I think.
And so she spoke about the sleep latency test, and she actually played a clip of Michael Mosley doing that. So that was a little bit seeing, we just lost Michael Mosley, and I love
Yes.
all of his little clips and information. And he did this experiment with people from his office where they lay in bed and they've got to have a spoon in their hand, and then they put a metal tray on the ground, and they set a timer and they just lay there. And if you fall asleep and within 10 minutes, so the spoon will fall out of your hand, make a big bang on the tray.
And wake you up.
And wake you up. So if you wake up and it's been 10 minutes or less, then you are sleep deprived. And if it's less than 5, then you need serious help. He said, because during the day you shouldn't be able to fall asleep easily. So that was interesting because I'd never had anyone speak about that before.
Fascinating.
She also spoke about, we're more than our bodies, to have love in our lives, like positive, strong social networks, because that promotes healthy cognitive function. I thought, what a great place to remind us of that, because you could feel that at the whole conference, that we were all together, we were all connecting, and it was just it was a vibe. It was a vibe. Laughing, she got us to all laugh at each other, which was quite funny. Have you ever done laugh yoga?
No, but I've definitely had that like fake laughter turn into real genuine laughter, and I find it fascinating and very fun.
Yeah, because that's what she was saying. Like, laughing is contagious. So and that positive psychology is a human functioning at optimal level. Like, so that's what we want, our whole bodies, our whole beings to be better. So be strong, be grateful, be kind, and be spiritual. And yeah, that was what it was about. So it was really good after mine that we got to do that, because they linked in really well together.
Nice. Yeah, that sounds great. It sounds like a really nice linkage, and it probably, for anybody who went to both of your sessions, they probably would have got like that compounding interest of those messages, which is really nice.
Yeah. Oh, and she also got us up dancing. She was telling us how movement doesn't have to be exercise. She prefers to say movement. And she played Dancing Queen by ABBA, and she got us all to stand up and dance for 3 minutes. And the whole room, it was really cool. It was really
That
cool.
sounds fun.
So I might pinch that for my next presentation.
Yeah, brilliant. Nothing like a bit of a dance break in the middle of a presentation. Okay, so then after those sessions, I went to my next one, which was Susan O'Hara from America, and she runs the Legs Like Mine. She has an Instagram page called Legs Like Mine. She has written most of the books on lipedema. Like, she has authored several books on lipedema.
I think it's 7. I think she's up to 7.
Amazing.
Yeah.
And she also has just created and launched a line of shoes specifically to address problems that lipedema women face with their swelling. So she is a fascinating person and a real beacon of hope in the lipedema community worldwide. And her presentation was so interesting because it brought sort of business theories into the real world. And this was all about how to be the best advocate for lipedema using your own skills and your own hobbies. So at first she started out talking about an elevator speech, which is sort of like a pitch. So if you have like 30 seconds in an elevator with someone and they ask you why you're wearing compression, like building out a dynamic speech that can address that really quickly. And some of the framework that she used was having a hook, having a few key points, emphasizing what's important, and then having a call to action afterwards. And that's how you build like a really dynamic pitch or elevator speech. And so I did mine, and I'm going to say it now. All right.
Yay.
So someone asked me why I'm wearing compression, and I say, I have a connective tissue disorder that causes my limbs to grow uncontrollably. It can result in mobility issues and other serious health concerns. So far, I've had 2 surgeries and need a couple more. I wear compression to try to control the growth. If you want to learn more, I have a podcast called the Lipedema Podcast, available on all platforms. And that is my elevator pitch.
Yay.
So that was really cool. It was a really cool practical exercise. A couple of other things that she asked us to do that were really practical was to think about our skills and then think about our hobbies. So I have really good organizational skills, and like I like to talk as a hobby. So, I like to share stories as a hobby. So podcasting is the way that I find advocacy the most natural, and it doesn't feel as exhausting. But somebody may have really good organizational skills and love event planning. So they may be really great at setting up some community groups and organizing meetups. So it was about identifying your skill and identifying your passion or your hobby, and then seeing what within the lipedema world you could do with those 2 things that could have an advocate lens to it. If you're a really good writer, then maybe you could do a patient story and publish, or maybe you could write to your MP. So that was really cool as well. And the last couple of takeaway messages was really empowering us to talk to health professionals like a partner. So as you were talking about, Shell, sometimes we get dismissed within the medical community or gaslit. But even if your medical professional doesn't believe you, you can actually ask and demand. Demand is a really strong word, but you can demand that your symptoms and concerns are being documented in your patient record. So that way, if things happen in the future and we get more evidence and we get more research and then we get a diagnosis pathway, you actually have proof in your medical records that you've been talking about this since 2014, 2016, 2024, etc. And your medical professional has to document these things, but you just have to, you might have to be a bit more pointed. Bringing a support person is also really good as well. If you're less confident, having that extra person there will give you a bit more confidence to ask for those things to happen. So those are my takeaways from Susan's talk, which is really cool.
Oh, that is awesome. I bought one of her books. I think one of Her Legs Like Mine. I did buy that book, and it was really good to read. It's really good. Yeah. All right. So while you were there, I went and saw our mate Kimmi Katte.
Aww.
And she was talking about meal timing, food choices, and hormone signaling, which was really cool because we have seen some of her messages before, but I love listening to her.
Me too.
She's a lovely lady. So she started by saying, if you're not ready, she doesn't want you to take any action at all. If you take in all of this information and you don't know where to start, don't. Park it, come back to it when you're ready. So that was really good. Instead of putting urgency on people, she's like, no, sit with it. And she was saying a series of small moves incorporated gradually without drama feels easy and yields big results.
Hey.
That's nice. Hey. And then she went into talking about circadian rhythm and hormones. And I think the thing, and this is me, when I think of hormones, I think of sex hormones.
Yeah.
I forget that cortisol is a hormone and melatonin is a hormone. And so these hormones are what wake us up and what put us to sleep. So in the morning when we wake up, we have it's cortisol that wakes us up. And if we don't eat shortly after waking up, within an hour of waking up, that cortisol keeps going. It doesn't know that, okay, there's my signal to stop producing and to chill out. And the same thing at the other end of the day. If we eat really late, our melatonin doesn't have time to accumulate. So if we can wait and leave a window at the end of the day of 3 to 4 hours, she said close the kitchen 3 to 4 hours before bed, then we can build that melatonin and be ready for sleep. So yeah, I never think of those things. So I got lots of notes. I got lots of notes for Kimmi, and I'm just trying to make sense of them. She then went on to say that leptin is impacted by meal timing because leptin controls our insulin and our cortisol production as well. I already said about melatonin. She said, eat your meals in natural light if you can. So go outside. Yeah, go outside and eat your meals if you can. That breakfast should be our largest meal and dinner should be our smallest. And I remember reading years ago, it was breakfast like a king, dinner like a pauper.
Yeah, I remember that saying.
You remember that saying? And she said, get sunlight throughout the day. And once the sun goes down, we want to make sure maybe dim the lights in the house or dim the lights, because if we have screens, the light from the screen makes our body think it's midday. It's the same light intensity as it would be at midnight. It's midday. So make sure your bedroom's always dark to sleep well. With meal timing as well, stop snacking. Try to eat just 3 meals a day. Because studies show that the benefit of calorie distribution with a larger breakfast, smaller dinner, and just those 3 meals is really beneficial for so many things in our body. I did take a photo. It was a big, long list of all the benefits. They did a test on, I think it was women with breast cancer, and they all, like, same calories. They could eat whatever food they wanted, but I think it was the same calories, but one group ate 700 calories in the morning and then smaller throughout the day, and the other group had smaller breakfast, lunch, and then 700 at night. And there was no change in the stats of the ones who ate the big dinner, but the ones who ate the big breakfast, there were ticks everywhere with insulin, cortisol, blood pressure, what's the stuff? What's it? Cholesterol. I'm like, your heart makes your arteries go funky. Cholesterol. And also with protein, making sure we get at least 40 grams of protein with breakfast. I think that study had that as well, 40 grams of protein at breakfast, because protein has a thermic effect, which means you eat the calories, but it burns calories. So it's like the gift that keeps on giving. It's like a bigger bang for our buck. Yeah. She also spoke about not eating below your BMR, which I think she mentioned that on our podcast too. So if you don't remember what BMR is, it's basal metabolic rate, and you can Google it, and it's what your body needs to do its basic functions in a day. So if you Google that number, you want to make sure you're not eating under that number, because that's not good for us at all, because we want to, she said, eat like the strong, healthy woman you want to be. How good's that? How good's that?
Good.
Let me see. Limit ultra-processed and ultra-palatable food. I think that was it. That was a lot, but I always love listening to Kimmi.
Yeah, so do I. I was disappointed that I couldn't go to everything. Like, there was so much on. This conference was packed. Lipoedema Australia did an incredible job.
But we have got 90 days to play it back, so we could come back with some more information as we delve into those over the next 90 days.
Very true. So my next session was with Dr Ramin Shayan, and it was about decoding complexity. Now, I don't want to butcher anything that he said, because as much as the title was decoding complexity, there was a lot of like infographics on the screen that sort of made a lot of sense as he was talking. And while I'm reflecting on some of the messaging, it probably won't land without those visual representations either. So I'm going to try my very best. But his what lipedema, the description of lipedema according to him, is a bilateral, symmetrical, disproportionate fatty tissue hypertrophy on limbs. So that's the little, in quotation marks, what lipedema is. And I thought I'd try and write that out verbatim for you guys. So lipedema can lead to obesity, diabetes, heart disease, arthritis, depression, and more things. But those were sort of the ones that I could write down in a hurry when he went to the next slide. He spoke about and it was like a big flow chart on the screen about how they work up a patient, and it's more than just their medical profile, it's their lifestyle and their psychological profile as well. So it's really multifaceted and complex, which is probably why it takes, when you go to see him, sometimes you can be worked up for 2 years before you go on for surgery. That's because they're building out the whole picture of your life rather than just looking at you as a medical case, which I think is really important. He spoke about lipedema being involved in microcycles, and these microcycles, when you think cyclical, there's no beginning and the end, and there's no one thing that everything influences each other, and it could snowball. And all of these processes that are within this cycle include things like lymph, inflammation, adipose tissue, lipedema, obesity, osteoarthritis, and lymphedema. So they all sort of can play some role can influence each other, can exacerbate each other, and we don't know which one came first. And like that's why it's sort of cyclical. So it's really complex. When he's building his patients up and working out what kind of surgical intervention he needs to follow, he's looking at those microcycles and he's looking at what things you have. So like obviously I have lymphedema and lipedema. I don't have corresponding obesity, but I do have inflammation. I don't have osteoarthritis, but I definitely have some kind of arthritis. That's probably like because it's dormant in the summertime and I'm not really sure, it's not been diagnosed yet, but there's some sort of inflammatory process happening for me. So when he's thinking about his surgical approach, he's thinking, does this patient need microsurgery, like for veins? Does this patient need bariatric surgery for obesity? Does this patient need orthopedic surgery for things like osteoarthritis? Does this patient need liposuction for lipedema? Or does this patient also need skin excision because they've had dramatic weight loss or they're getting a lot of volume removed? So all of those surgeries are something that he's looking at in terms of what your management is long term. He said something that I hadn't heard as a message, and it came up later on as well, that fat is normal. We still need normal fat. We can't just not have fat on our bodies. Fat is protective, fat is healthy, and fat is normal. And I thought for this particular conference and for our particular group, we probably don't get reminded of that very often because we're always dealing with excess fat and excess tissue. But we have to remember that some fat is really important. He also mentioned that when he removes lipedema fat, there is still lumps and lipomas which are smushed in with our connective tissue, which is why even though we are smaller, sometimes we have still a lumpy appearance under the skin, and it's probably not like cosmetically the most ideal thing, and it's about managing our expectations about what we might find with our bodies on the other side of surgery, because we're not going to have those incredibly smooth looking legs. We have a condition, the condition doesn't go away, we take away the excess tissue, some of those lipomas remain in our connective tissue, and they can't be removed without traumatizing the skin, and traumatizing the skin has heaps of other impacts, especially for people with lymphatic issues like us. Mm-hmm. So those are my takeaways. And the older
you get too, hey, the older you are, the more impact it has on your skin. Yeah.
For sure.
All right, so I was listening to Dr. Rosie Worsley. She is an endocrinologist from memory, and she was talking about medications, menopause, and hormones in lipedema management. And it was quite entertaining is the word I want to say, because she was saying things and then she'd bring up this empty slide and the heading was current understanding of how hormones affect lipedema. And then she just stopped. She goes, there's nothing for this slide. It's quite funny. So, but she went into what hormones are, and they're chemical messages that signal the body on how to act in certain ways. And lipedema is triggered by hormonal events. But she said, as women, we try to run the whole world during our hot flushes. So yeah, that was. So she went on to say what menopause is. It's irregular bleeding, hot flushes, night sweats, poor sleep, joint pain, skeletal discomfort, mood changes, and weight distribution change. So yeah, and menopause doesn't kick in until you've had no bleeding for 12 months. So it's so perimenopause and premenopause can take like 5 years, because you might not bleed for like 10 months and then all of a sudden it comes back. So you reset again and have to go again. So, which is, yeah. And then she had another blank slide. How does hormone therapy affect lipedema? So we had another blank slide. But it was quite funny. She was like, sorry, couldn't find anything. It's like, but she said estrogen makes joints looser. So even though it benefits hot flushes and it improves your sleep and your mood, it does, if you're hypermobile, it's going to have an impact on your joints. And our joints, like I'm hypermobile, so my joints are already very loose. So if I had estrogen to help with menopause, it's really going to damage me unless I have something else to combat that, because my hips are just going to be way too loose. What else did she say? There's 0 studies into medications that help lipedema, but she did go on to mention the GLP-1s, like the Ozempics and those sorts of things. But she did say that they are bloody expensive. She didn't say bloody. I'm saying bloody expensive. They cause gastrointestinal issues. They do reduce your appetite. They reduce insulin resistance, but they're expensive and there's some terrible side effects. And also, you don't want to be losing. Did we already talk about that? About we want to keep our muscles. We want to keep our bone health. I think we spoke about that yesterday or in day ones.
Yeah.
And these drugs do just make you lose weight from muscle, from everything. It's not just targeted. She referred to metformin, which is another diabetic medication. She said it's super cheap. It's like $6 a box, super cheap. It's the poor man's Ozempic. Okay. She said you may get a small amount of weight loss. It could possibly be anti-inflammatory, but the side effects are nausea and vomiting. And then she went on to, I can't remember the name of the group of drugs, but she said Duramine. And she said that they are expensive too, but they act like a lymphatic pump, because your body, it's like, I always refer to it as medicated speed. It's like your body is going to be going like crazy. She said, so pump, 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 but then you'll get anxiety, heart palpitations, and it's addictive. So I think we were going to talk about that in another episode anyway, weren't we? Because we've both had experience with that.
Yeah. Nice. That sounds like a good presentation.
Yeah, she was good. And she has lipedema. And and she sat on a chair, which was nice. Like, it felt cozy when they sat on chairs. And I think that was the same with the panel. When they sat on chairs, it felt a bit cozy.
Yeah, true. All right, so we are almost at 40 minutes for our episode, and we have 2 more like sets of notes, I suppose, to go through. So I reckon we just go 3 takeaways from each, and we'll start with Tara's talk. Tara Karnezis, who is an amazing researcher and does so much work with lipedema, spoke as a keynote speaker next. And her talk was about giving hope to lipedema patients, a summary of recent and ongoing Australian-based research. So a couple of things that I took away was when she spoke about fat cells, and we're talking about healthy fat cells expand in size and then decrease in size, like as we fluctuate with weight. But when we talk about obesity, weight gain, fat cells can actually expand in numbers as well. And I thought that was interesting because, most of the messaging is around we are born with one amount of fat cells, and they just expand. But Tara was saying that discounts the metabolic processes like obesity and other things where you can actually grow more fat cells. The other thing that she was talking about, which was interesting, was lipedema fat cells are typically larger than regular fat cells in size, and there are more stem cells in lipedema fat compared to obesity fat. She also said that even with those more stem cells, the stem cells grow faster in lipedema fat, so there's more of them, and they grow faster than the stem cells in obesity fat. there's a different genetic profile that encourages growth. So that just demonstrates that normal fat cells and lipedema cells are different beasts.
Yeah, absolutely. And they look different. And Dr. Ramin said when he was on, they feel different. When you get the lipedema adipose tissue, it's different. It's sticky, it's white, it's different to normal fat. She'd also said that they found that the collagen was higher in the lipedema tissue. So it's got more collagen and different combinations of the collagen. So, from memory, do we have like 8 different collagen profiles? We had different combinations of them. Like, so if a normal cell is, 5, 5, 10, 5, ours might be 10, 7, 8, 4. We don't have the same profile. Sorry, they were made up numbers. If you didn't get that, I was just trying to show that that it's different.
Different. Very good. Point taken.
And she also said they have identified a gene X, and gene X is responsible for fat development. And if they are hoping they can produce an Ozempic type medication, like an injection, that turns off Gen X and its production of fat, and that would benefit lipedema.
Right,
because we have a huge volume of Gen X. So they have Gene X. They haven't named it. It's just Gene X at this stage. But yeah, she said that they are hoping they can figure out a way to turn it off.
Oh, that's very cool. Fingers crossed.
I know.
I hope they can too.
Just turn on the switch, Tara. Let's go. All right. And then we had Linda-Anne Kahn, and she was talking all about fascia and the vagus nerve. So the vagus nerve. The vagus nerve is that gut-brain connection. So it goes from in front of the ear, it goes behind the ear, and then down into our tummies. And she was saying how important that is, and that we need to look after it. So one of the ways to look after it is humming, singing, laughing, breathing really deeply. And then you can pull on your ears and massage around your face to get it working. And it's all fascia. Like, everything is connected. Our fascia is like this big scaffolding that holds everything together. And and fascia, we heard the word fascia a lot over the weekend because it's the connective tissue. Like, there's all these different connective tissues, but the fascia is the web, the sticky spider web that holds it all together. And not only does it hold everything together, it holds emotion. So if you've ever been to yoga where you do that pose and you just start crying, that's your fascia letting go of all of those emotions, particularly in our hips. We hold a lot of emotion in our hips.
Nice. I forgot that I missed out on Linda-Anne Kahn's discussion. So thank you for writing those notes. That's awesome. The last one that you and I went to was the nutrition panel, and that one consisted of Vanessa Armstrong, Kimmi Katte, and Meegan Pfeffer. So 3 amazing ladies that we heard from Kimmi previously, and a couple of takeaways that I got from that. Kimmi reminded us that inflammation is a necessary process when we're talking about acute inflammation. So think break arm swells. That kind of inflammation is good and we need it. Injury recovery, acute inflammation, good. Chronic inflammation, not so good. And chronic inflammation is like arthritis, and which is like one of the easiest examples, I suppose.
And chronic means long term, everybody.
Yes.
If you're unsure
Sustained.
of that, chronic means sustained, like a long term thing. Acute, short, sharp, chronic, long time.
Yeah, nice. So when I'm talking about arthritis, there's some also inflammatory markers that you can find in a blood test if you wanted to get tested. If you have high inflammation, you could get symptoms like joint pain, gut issues, brain fog, fatigue, and that sort of thing. Ultra-processed food is definitely one of the causes of inflammation, especially if, like, Meegan always talks about like the devil's in the dose, or a similar, that dose is in the poison. The poison is the
Poison's
dose.
in the dose. Yeah.
Thank you. And so, having an ultra processed meal once, you go back to your real food diet, not a problem. But having it for breakfast, lunch, and dinner over a week, 2 weeks, or something, that's when you can start to get chronically inflamed.
And that also plays into, like, there was lots of talk about mast cell and mast cell activation, and so mast cell activates histamines. And if anyone's ever had an allergic reaction, or like hay fevers, hives, one of those, you will know that the histamine response, like I know I'm like this, like I could eat little bits of something, particularly like dairy. I can have lots of little bits and I'm fine. But if I have it for too long, then I get hives, I get sinusy, like I get all of those because it's that histamine releasing to try and protect you. So that goes back to, the devil's in the dose. Yeah.
No. Yeah, perfect. Do you have other notes from...
I didn't make any notes, but I remember there was, because it was the Q&A thing with the app again, and one of the questions was eggs. So we need to make sure we're getting enough protein for breakfast. Like we mentioned before, 40 grams of protein to aim for breakfast. Eggs aren't really high in protein, but they are a whole food. They're a brilliant whole food. So all three panelists said they have 4 eggs for brekkie. And it was asked, should we limit the amount of eggs they had? And they said, no, you can't have too many eggs, but make sure they're good eggs. Don't be buying the cheapest battery hen eggs, which I think they've made changes in the supermarkets now that you can't sell battery hen eggs. They only have the free range and the cage free now, although that's a bit of a whole thing, because I think to be cage free you only have to have like a door open about 30 centimeters or something, and they got to have access to sunlight. But when you've got 1,000 chickens in a shed, that's not very much. But that's a whole different story, and that's me watching documentaries I get a bit caught up on.
Yeah, so with the caged eggs thing, and like the also meat, like high quality meat, you'd think grass fed meat. Poor quality meat, you'd think grain fed meat. And the eggs, caged eggs versus free range eggs, it actually changes the omega-3 to omega-6 profile.
That's right.
So it's less quality in terms of the omegas for us, in the balancing of omegas. The last thing, which is a habitual change question, which I answer, which I found quite powerful, was they were talking about like making changes to your diet, and Kimmi said sometimes it's harder to think about making a change than actually just doing it. And I thought that's so true, because sometimes we just obsess over the fact that it's too hard and all this stuff that we have to do, and if we just sort of did it, it would get easier over time. So I thought that was pretty powerful.
That was powerful. That was really good. Awesome.
Yay. So that was like our recap. Now there were some other
Yeah, there was a Q&A with Tara and Karen, but I didn't write any notes down on that.
No, I was just fascinated by their responses. The one question that I asked both of them was about whether we are born with lipedema fat cells or whether our normal fat cells turn into lipedema, and we just don't know. They just don't know yet. And we won't, like the ethics about testing the fat cells of like infants, it's probably not going to be, we won't be able to do that in the near future, and especially not in utero and everything. Like you can't. Yeah, so I don't know.
For research purposes, there's no way they will
I
ever
don't
be able
think
to
there
do
will
that.
be.
Hey?
Yeah, I don't think there will be anything like that. Anyway, that was day 2, and
I'm very excited. I'm very excited to say, or we might. No. Do you know what? I'm going to make you hang on with the excited thing. I'm going to save it for the next one.
Ooh, okay. Until next time, we'll be back. Our next episode is going to be a behind the scenes because Shell and I went to the Lipedema conference as like supporters of Lipedema Australia and Lipedema Warriors. And unbeknownst to us, we got in a completely different experience because we are the co-hosts of this podcast. And so we wanted to share with you like this, our next episode is not really lipedema related. This is just a behind the scenes look at our weekend. And so we will catch you on the next episode.
Bye.
Bye.
When we started the Lipedema podcast, we relied on word of mouth and existing connections.
Our following has happened organically, and we are so honoured by your support.
As we learn more about the world of social media and algorithms, we have a request.
When you are listening to our podcast or watching on YouTube, let us know what you think.
Hit follow or subscribe.
Leave us a comment or write a review.
The more engagement we get, the more our message is shared.
And the greater our reach to those women suffering in silence.
Thank you for listening to the Lipedema podcast. Lipedema and its symptoms vary from individual to individual. The opinions and advice voiced in this podcast are of a personal nature and used for educational purposes.
Please take away from this podcast what resonates with you, and please see your GP or preferred specialist for diagnosis and healthcare. We are Shelley and Tiana from the Lipedema podcast. Until our next episode, bye for now.